Well, good afternoon, everyone. It is January 18th, 4 p.m., and this month's Board of Health meeting is now in session. Just to remind you all that this meeting is being recorded both visually and audio-wise. I would like to open the public comment section. Otherwise, any issue anybody would like to bring before the board that is not on the agenda. It's very quiet in the room. Is there anybody online? Fine. We have 2 minutes to approve. The dates are, someone read me the dates of the minutes.
Give me just a moment.
I didn't get all my papers out.
December 14th.
December 14th, 2023, and November 16th, 2023.
December 14th minutes, are there any comments, additions, subtractions? Hearing none, may I hear a motion to approve the 14th meeting minutes?
Second.
The motion to approve December 14th meeting minutes.
Mayor, seconds, all in favor, say aye.
Aye.
Chairman says aye, they're approved. And the second date was,
November 16th, 2023.
do I have a motion for approval?
Motion to approve.
Do I hear a second?
Second.
Any discussion? Any objections? All in favor, say aye.
Aye.
Chairman says aye, the minutes are approved. We had a emergency condemnation.
Yes, so just this week, we had an inspection on an emergency basis where we found the property in severe disarray, some real damage happening with some hoarding. So what we are asking is that, just a moment, I'm getting a text from, okay. Just was NCTV confirming we have a good cast, a good simulcast. That we had to emergency condemn the property due to severe hoarding, severe damage to the property, and bug issues and things like that, and mold. So we need the board to ratify that condemnation.
Any questions from the board? Just one question. How are you aware of the property?
Hi, Kathy Flynn, Health Inspector. Last Friday, we got a call from the Nantucket Police Department for someone passing away. And the call was for hoarding and living in squalor. So we went and we inspected the property yesterday, and it was pretty bad. So we condemned the building today.
All right. The pictures were quite striking.
Did you see the pictures already?
Yes.
Okay.
Yeah.
Yeah, we sent that in the packet yesterday.
Yes. Any other questions from the board?
Who lives there? I mean, is it the owner or a tenant?
In this case, it was a tenant. We usually have property owners for in the condemnation situation, or the ones that I've dealt with in the past few years. So this time around it was a tenant.
Yeah, so do we know, was the property owner aware of this? I mean,
Yes.
Okay.
Property owner was aware. She met us yesterday. And then we will go back next week and make sure that the building is secured.
Okay, thank you.
You're welcome.
Yeah,
Anything
it's-
else?
It's just unfortunate. It's hoarding, as we know, is a symptom of mental health illness and stuff. So it's unfortunate that we are starting to see more and more of it as we're being more involved.
It is.
We're trying to get ahead of it, but we need a lot of work with some of our local nonprofits. We'll be working together and collaborating as we move along.
Good. Do we hear a motion?
Motion to accept the condemnation request, 2.5 Marble Way.
Second.
Any further discussion? All in favor of approving the request, say aye.
Aye.
Chairman says aye. Septic loan request,
Yes, so
74 Arkansas.
yes, so this is one of those that we have to just completely deny because it's Heather's. I'm kidding. So this is a situation that we have run into before. Depending on the underwriter for the mortgage that gets requested, sometimes they ask to
Right.
have the approval for a higher number, like a 50% more or 100% more, the cost of the septic system in case there's funding overrides. This is just one of those cases. We've approved this many times before where what it comes out is they're approved for a higher number, but very rarely do they ask
You
for
actually
that
use
full
it,
number.
yeah.
So
Didn't we
we have-
already approve this one? at
Yes,
the
we
last
approved this one
meeting?
at the last meeting. We just need to increase the appropriation for it because the underwriter asked
For
that they
more.
approve more. We have no objection for it. We've done this many times before.
Any other questions?
It's unfortunate, but
It happens.
I know the underwriters, and also the reality is the estimate you get may not be the cost it's going to be at the end.
Exactly.
And they're protecting their investment too.
Correct.
So
Is this one of the ones that is, they're getting 100%?
Yes, it's a local year-round family. It's always the good news that we're trying to find.
I mean, again, we've done this before, I'm
Yes.
assuming. I mean, this is not a new situation, since I'm assuming
Correct.
banks have always been banks.
Exactly.
It's their job, I guess.
Yeah, they're protecting their investments. So
Yes.
it makes sense.
Okay. Any other discussion, any questions? Do we hear a motion?
Motion to accept this override loan request for Arkansas Ave.
Do we hear a second?
Second.
Further discussion? All in favor, say aye.
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 Chairman says aye, the request is granted. Title V release. You have to excuse me, but this is very small print. I must compliment you, though. My name is being spelled right. And actually, the quality of those minutes that we approved were actually excellent minutes.
Our new minutes taker is tremendous.
It's really terrific.
So Elena, I know you're watching this. We really appreciate the work that you've been doing. So thank you.
So my next request is if we could build larger print.
Sounds good.
For some of us that have some handicaps.
Sounds good. I'll bring magnifying glasses to the next
Thank
meeting
you.
too.
This is Title V request for 3
Salrus.
Salrus Road.
Yep. This is the betterment release, correct? Yeah. So this is a betterment loan that we have issued already. System in the ground, everything's good. It has been completely paid back. So in order to release it, to release the lien, it requires a vote of our board of health. So we have no objection.
Any questions from the board?
And this is the money that goes back into the fund for,
Yes, if any excess funding, if they didn't use all the money, it goes right back to the fund and has become available to the next
okay,
donor.
excellent.
So yeah, all the money has been repaid, including the interest.
Anybody else, any other questions? Do we hear a motion?
Motion to release the lien for 3 Salrus Road.
Second.
Any further discussion? All in favor of releasing the lien, say aye.
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 Chairman says aye, that is approved. Public health nurse update.
So our public health nurse, Erin Schrader, is about to speak.
Hi, guys. I'm Erin Schrader, the public health nurse. Just wanted to give a little update on where we are, mostly about respiratory illness right now. We are in the midst of a pretty intense respiratory season. I will say we have hosted 4 clinics in 2023, and we vaccinated 969 people in total, 717 against COVID and 252 against flu. So we're working on it. We've got a couple more clinics planned. One is for this Saturday. We want everyone to know that it's not too late to get your flu shot or your COVID shot. There's still time. We're still kind of right in the middle of the season. Across the state, I'm a little concerned about Nantucket's overall vaccine numbers. We are currently last in the state for the flu. Our vaccine rate is about 27.4%. And we are seeing very high levels of flu across the state. And we're definitely seeing high flu numbers here on the island as well. So There's that. We're also about third from the bottom for COVID. We're running there for our COVID vaccines about 13.8%. So our COVID numbers are presenting in a more medium, mild, moderate range. I think that's partly due because not as many people are coming in, which is great, to the hospital. But people who are testing at home, those numbers aren't being reported. So I believe by the data that we're seeing that it's still out there. So I would very much encourage people to still sign up for the clinic, come in and get your flu shot. You can sign up online at the town website. So that's respiratory illness. Also, I'll be leaving on leave in mid-March. I'll be out for a few months. Keziah Duarte, our per diem nurse, will be taking over in my stead. Those are the big things that are happening right now. We've also been hosting QPR trainings, which are to help promote mental health interventions for people that are struggling with suicide, so that friends and family can feel a little bit more comfortable intervening, knowing what to do, knowing what resources we have available. We have some trainings that are coming up as well. I believe the next one is February 12th, which is Monday. So if anyone's interested in that, please give me a call, hit me up at my office. My number is on the website. Thanks very much.
Thank you. If one of your theories is our low rates are due to COVID testing at home, but if shouldn't that be consistent around the state? Is there another reason why we're so low? I mean, considering, supposing COVID testing is equal everywhere.
Oh, I think I was referring to across the state, we're having sort of medium to mild numbers.
Yeah, but we're still worse than the rest of the state.
Almost, yeah.
On our vaccine levels.
Yes, our vaccine, I'm sorry, yeah.
Sorry, no, I just wanted to clarify my own understanding. Yes, that's correct. We're like third from the bottom.
Is there a reason for this?
I don't know that reason right now. I'm not sure why we're not seeing more interest or more people coming out for the flu vaccine.
Yeah,
I don't know right now.
We reached out to the schools. I don't know if the superintendent ever sent out the.
Yeah, we sent something out.
It's just response is lower this year. It just seems really interesting.
I also think in the past, it has been, in the past few years, there's been a lot of like drive up and get your flu shot. You don't even have to basically get out of your car, which I
Right.
think drove more people to go do that. I think in my 6 years at the schools, our community doesn't necessarily do, I think, as much flu vaccine as we could. I mean, we weren't even, the town wasn't even offering it until the last couple of years. So I think there just hasn't, I mean, I just did the state survey on vaccines for all of the pre-K and kindergartners, and very few of them have flu vaccines. And the flu is rampant right now. Flu and COVID and RSV, I have had so many kids out. So, but I just don't think people are vaccinating. I don't think kids are getting vaccinated necessarily.
And that does track with some data. So if you remember this past summer, we released a survey about the COVID response. And one of the questions, it was the reasons I received the COVID vaccine were, and I asked them to pick 3. And one of the most common questions, one of the most common answers is the convenience. It was, they came to my place of work.
Mm-hmm.
So there's definitely a convenience factor that drove our high vaccination rate during the outbreak, because there was a sense of immediacy. Now that it's, quote, old news, if you listen to some of our news out there, COVID and flu are just going back to their baseline rates. I think we're starting to see the adjustment of what we're seeing. And our baseline rate before COVID for flu was also always very low. This year as well, one of the things we noticed was there wasn't as much of an emphasis on the availability of the 2 shots by our local our single largest care providing organization on the island.
I think they used to advertise.
They used to
flu
advertise a lot
clinics
more.
Where you could, there were ones where you could just drive up.
Yes.
They had flu clinics where you just walk in and get your flu
Right.
shot and walk out.
Yeah.
And that has sort of gone by the wayside, that you don't, it's not as easy to
Yeah.
get a flu shot.
It seems like
was.
this year has been a bit of a reset year for a couple of healthcare organizations because we're seeing the same thing happening on the Vineyard. Even Island Healthcare, their federally qualified rural health clinic, said that they've seen low numbers. However, they do have Dukes County does have a higher vaccination rate than Nantucket County. But some of the lowest, it is county numbers. I will couch that information. We are not in the lowest 3 communities in the state. We are the 3rd lowest county. So that includes Barnstable County, that's Suffolk County, Norfolk County, Worcester County.
Right.
So we do take that with a grain of salt, but it is still lower than it has been since I've started here.
I think overall, our vaccine, like for all vaccines, rate is a little bit lower than a lot of places in the state.
Yeah, always was.
It's better than it was, but it's,
Well, remember about 10 years ago, 8 years ago, we did a vaccine survey in the schools?
I do one every year.
Yeah, we did one, the board did one, and we collected also the private schools.
Okay.
And we were okay.
That might have been before my time. I don't
Must have
remember
been
doing
before
that.
your time.
Yeah, I don't
And we
remember
were
doing that.
okay comparing ourselves at the state average. That was probably 10 years ago we did that.
Across the board in the entire country, we're seeing lower vaccination rates. That is one thing that we've definitely looked at. In the state of Massachusetts, which happens to be a very good, for lack of a better word, compliant state when it comes to vaccination rates, we're not doing great when you're doing an apples to apples comparison. When you look at Nantucket County compared to something like Chickasaw County, we're still very high.
Yeah.
Because it's just a matter of what you're comparing it to. When you stratify that data, we show up worse in that stratification. But when you look at the amalgamation of data across the country, we're pretty much right smack in the middle.
Well, the spirit of the times is vaccination rates nationwide in all areas are lowering.
There's
And, that is tied to just the climate we're in right now.
it's part of the
where
culture war we're in.
Everything being questioned,
Correct.
and the efficacy. And if you don't know about flu epidemics from the past, it doesn't. Why does it matter now?
Yeah.
I think there's a historical kind of blip that occurs through generations.
It's unfortunate that we're in this moment of civil turmoil where science is no longer regarded as fact. There is a bit of a culture war there, and we are fighting against that tide. But I do applaud the efforts that our nurses are doing. There is, at least since I've started here, there's never been more communication between the schools and the health department.
It's awesome.
It's very different. So it's a big deal. And I think if we take this year's data with a bit of a grain of salt, because there are a couple things there. The segue to this conversation was into the director's report, where we are in the process. Yeah, you're good. Where we are in the process of recertifying all our refrigerators and freezers for vaccinations for the Massachusetts Childhood Vaccination Program, and that way we will be able to start offering MMR, Hep B, flu, all the school vaccinations, and we're going to be able to actually offer that at our office, which is something we've never done before.
Yeah, that would be great.
Which is really amazing because it takes a long time for some of our students who are new to get established and get a provider. And then if they don't have, if their vaccination list is not in English, it takes longer, and it would be really nice to make sure that
Yeah.
they're vaccinated.
And the biggest boon for the community on that is that it's free. It is like, we can reimburse if you have insurance, but it is regardless of insurance and of capacity to pay. So it's free to anyone who needs it. So that's part of that's the best part of the MCVP program. And that's where that's one of the things that makes Massachusetts such a high vaccination state, because the state offers those vaccines for free. Tdap, flu, there is MMR, there's Hep A, Hep B, COVID will be one of them eventually. And then there's a couple others that will be offered. And then the other conversation that we're having internally is if we are able to get our own reimbursement information, our own DEA number, and certify our own area as a clinic as well, we should also be able to start being able to offer travel vaccines as well, which will fall, yellow fever and the other hepatitis vaccines and things like that. So we're in the process of moving the department forward from a clinical and community health aspect as well.
I mean, that would be fabulous, because it is a bit of a challenge sometimes to get a vaccine on this island, even for those who speak English and are here a while and have a provider. It's still difficult.
Absolutely. So we're starting to model, we're looking to model our program over some of the other communities that we have that have a much more robust community health aspect, like Cambridge, where Cambridge, what they do is they hold standing vaccination times. So I think it's Tuesday for them, they have a long day in the office. They close early on Fridays, but they close late on Tuesdays. And from the hours of 5 to 7:30, you can walk in and do a vaccination. But that is a program that is funded and supported by the Cambridge Health Alliance, which is something we don't have here.
Well, in a couple of years, you'll have Lyme vaccine too.
We're looking forward to it. So,
anything else?
I just, I guess that's really good to hear that we'll have greater capacity, and then the other whole thing will be, how do we market and let people know, and find those places where people will see it and say, oh, it applies to me.
exactly.
Whether it's data behind it or just good advertising or something, but again, it's not always easy to find, and you got to really go to the people instead of telling them they got to come to us.
The good news with that is, as we move forward, this coming fiscal year, we have some money in the budget for outreach consulting services. So we can start creating these. So it's kind of content creation for us. I think it's $50,000 that's in the budget, split between natural resources and us. That will be able to do this sort of content outreach, things like that.
Great. Excellent. Thank you.
I mean, I think between the schools and your VNA visits, that's a great way to get people in and give them the information.
The VNA visits have been tremendous. That contract with the VNA is something that we're looking to start growing in up and coming fiscal years. So that's going to be a good partnership. That's part of one of those nonprofits that I was talking about earlier, so that we can start doing home visits and things and wellness checks. And then for the rest of the director's report, if you mind, I can move on.
No, I mean, any other public health nurse questions? Then we'll go on to the director's report. It kind of all rolls together.
Exactly, it kind of rolls. So the good news, we've scheduled a meeting with Henry Lind and Patrick Roden Reynolds from Martha's Vineyard in Barnstable County. So Dukes County and Barnstable County and Nantucket County are going to be meeting to get on the same page again on how we're going to approach tick-borne illness outreach. If you looked at our website recently, the tick-borne illness web page on the Nantucket website has been completely revamped, where we've added some videos, more information, more brochures. So that is something that we're going to start pushing out through social media, through the airport, through listservs as well. And I'm going to be reaching out to our other local news outlets to be able to get that information out. So we're looking forward to that. We did have I'm sorry, I didn't bring the numbers with me. We did have a rough tick-borne illness year because up until this week, we had a very mild winter. So we were still getting some Lyme hits, Lyme positive, confirmed Lyme positives in January, these last 3 weeks. So it's something that we very rarely see.
Yeah, that's unusual.
So
But for 2023, what were the numbers?
unfortunately, I don't have it in
Just
my
bring
head.
them next time.
But yeah, I can email them out as well.
Yeah.
So I'll do that. And then, Sean, correct me on the date if I'm wrong, but we are offering another ServSafe Managers course at the beginning of February. It's February 6th, 7th, 8th, and 9th. See, I had 6, 7, and 8. So 7th, 8th, and 9th, we are offering a ServSafe Managers course for anyone looking to open a restaurant or be a manager at a restaurant or anything like that this year. This is the first year we've done it as the town, and the first 2 sold out. So we added this third one, and it's also got a good response. So we'll be continuing this moving forward. So Sean will be teaching the class and overseeing proctoring the exams. And then I'm going to take this moment to also publicly congratulate Sean for something that he's done that we never acknowledged. Sean took the Certified Professional in Food Safety course and exam this year and passed on his first try, which is a big deal. It's a national credential. The
That's great.
CPFS credential is something that you see as an industry standard for corporate sanitarians. So these are people who oversee multiple restaurants like Legal Seafood or Not Your Average Joe's, and restaurant groups is where you'll see CPFS. So we really appreciate Sean moving forward and getting that
Congrats.
credential.
Good work. Congratulations. Good.
And then Jake also proctors the ServSafe exam and does the ServSafe manager teaching as well. So they're both certified. So we're moving our staff forward credential wise. So it's a big deal. Everyone's moving forward, and I know we're moving John forward as well with some classes to get the registered sanitarian course. So it's moving the health department into the 21st century. Yeah. And then the next thing that I have is the new inspector position was posted to replace Kathy LaFave's retirement. That we have a few applicants, and interviews will be performed next week. And then hopefully we'll be able to have that decision shortly thereafter on who to hire. So we're moving forward with having a full complement of staff.
Are you getting applicants with the required education, or do they
Yes.
have, so you don't have to have them?
Yeah, no, we have some really good applicants, actually. We have an internal application, and then we also have an application from the South Shore, south of Boston, that is also a registered sanitarian. So there are some pretty good, everyone else, the other applicants as well, all qualify in their education, but these are the 2 front runners on
Well,
that.
I hope if it's an off-islander, you have a house.
We're not allowed to ask that in an interview. And then the short-term rental program is on its way. GovOS is in the user acceptance testing right now. The website is live, but only for a few select people to run through it. We're getting some good feedback from our real estate program. So that team is Kathy Baird, Lisa Wynn, Penny Dye, Matt Heffenrepper, Brian Turbett, and myself. We're reviewing the user acceptance testing program right now. We've received some really good comments, and GovOS we're hoping that they will have those comments integrated at the end of next week. And then we've been working with the Cottage Hospital on the community health assessment with their intern, Cynthia Godet, who is a doctor from UMass, I believe. She's getting her master's in public health as well. So she'll be an MD, PhD, and she is running the community health assessment. And we've given her a lot of data from our end, and we're hoping to have that CHA out by the end of this fiscal year. in July. The water on Tom's Way is being moved forward. We're moving town water onto Tom's Way. I think they broke ground just last week, I believe. That is in response to the record level of PFAS contamination in some of the drinking water wells. One of the things that we did see is that all the primary level of contamination, the highest numbers that we were seeing were on the east side of Tom's Way. All the neighbors on the west side across the street were showing up, in some cases, non-detect. So we're trying to see what is going on, what it is geohydrologically, how that PFAS got into the groundwater there at such a high level. Because some wells came in at 600 parts per trillion, one came in at over 900 parts per trillion, so which is imminent hazard levels based on the EPA standards. So they should be connected to town water within the next few weeks.
So are they waiving the fees to connect them? to
We
town
were
water?
able to secure a grant from DEP that they will be able to pay for all those fees. So the fees are not waived, but they are covered. We're just waiting on contracts and things like that.
Okay.
So that's not set in stone yet, but the residents are not going to have to pay out of pocket.
Good.
And then lastly, on PFAS as well, PFAS testing is now available through us, through our normal water testing program on Tuesdays. So Barnstable County Lab was able to add and certify their mass spec, their GC mass spec. So now we can also do PFAS testing. So with the new well regulation that we passed, that is started on January 1st, we now also have the capacity in-house to accept well PFAS testing. And then
That's great.
lastly, last but not least, I will also be leaving in March for family medical leave. So I will be out for a few months on that to raise our newborn.
Congratulations.
Thank you. So, and that's it. Second to last meeting before then.
Any questions? Yes, congratulations.
Thank you.
We'll struggle on.
Well, we have a great team. The department can run itself in my absence. They're really good.
I
have faith in these two.
think those of us that have been here a while on this board have really seen a transformation. It's very, very, very proud, very congratulations, doing well.
Appreciate that. Our team, we have a great team, and this is 80% of them. So we really appreciate it. They've made these last 8 years possible.
That's great. Okay, anything else from the board? Any comments, reports, concerns?
I'll hold off till next meeting.
Oh,
Oh,
Got a couple questions, but nothing, more just questions, just like,
Okay.
stuff that
We can-
percolating in, and I
We
may just
can
meet
meet.
with Roberto just to kind of bounce him around and see if it's even thoughts I should even have in my head.
I'll bounce it around. We'll wait for you.
did we ever hear anything more, or have we heard anything lately from our request to the town about the firefighters?
Yes, there are negotiations going on between the town and the union. And I really can't get into the details of those publicly. But they're continuing to discuss to find a solution to some of the issues that are holding it up.
I'm happy to hear that it's being taken serious. I'm happy to hear that it's being taken seriously and being,
I think
and being negotiated.
I'm quite convinced, recent meeting I was at, the town is taking it very seriously. It's just a matter of actually doing it will probably be simple. It's getting there has some hurdles. Okay,
That's a fair assessment.
does anybody want to stay or do we have a motion to adjourn?
Motion to adjourn.
I second the motion.
All in favor?
Aye.
Aye.
We are adjourned.
Good grief.